Hi, Laura.
Yep.
Hi, I'm Sam. I'll be your student nurse today with Hack.
Okay.
I'm just going to take a quick look at you, ask you a couple questions. I'm just going to wash my hands,
Okay.
close the curtain. And so, could you give me your full name and birthday?
Laura Hollenbach, 11/25/1990.
Okay, just verify. Good. And do you have any allergies I should know about?
No.
Okay. So I am just going to ask you some weird questions here to start, and I'll get your
Okay.
vitals, okay? So you gave me your name. Do you know where you are?
I'm at the hospital.
Okay, and what day is it today?
September 1st, 2020.
Okay, and who is our president?
Trump.
Okay, so she's alert and oriented times 4. Telling camera of the patient. And I'm just going to get your vitals quick, okay?
Okay.
I'm going to get your blood pressure.
Okay.
Doesn't matter which arm.
No, this sounds fine.
Okay, I'm
Right
going to wash my hands. And I'm just going to clean my stethoscope. Strapping it on. Blood pressure. Okay. 126/89. All right. I'm going to check your pulse oxygen.
Okay.
Your pulse ox. So I'm going to put this on your finger, cleaning it. And I'm going to check your pulse, okay?
Okay.
Pulse is 68, respiration is 20, pulse ox is 97%. Just need to get your temp. Okay, under the tongue. All right, good. 97.9.
Okay.
All right, what brings you in today?
Stomach pain.
Stomach pain? What would you say that pain is?
Probably like a 2 out of
2?
10 right now.
Okay, so we'll address that once I take a look at your abdomen. I'm just gonna start from kind of head to toe, and we'll go from there. I'll ask questions along the way. So I'm gonna put gloves on. Do you mind if I look at your head and your scalp? Okay. So I'm just looking through here for dryness. Hair looks good. Looks healthy. Okay, take a look at your ears.
Okay.
No redness. Earwax. Same on the right.
Okay.
Okay, looks good. So gonna take a look at your eyes, okay?
Okay.
First of all, do you wear any hearing aids or anything like that?
No.
Okay. And I can see that you're responding fine. I'm just gonna take a look at your eyes.
Okay.
Just look directly at me. Okay, 3 both sides, good roundness. Could you pull your eyelids down for me? Okay, looks good. I don't see any discharge or anything like that or redness. I'm gonna shine this flashlight in your eye just to kind of test the reactivity. Just look at me. Good. Good. Okay. And if you could take a look at this pen light, I'm going to move it towards you. Just keep an eye on this. Good. So she is reactive to light and tracking, accommodating properly. Okay. I'm going to take a look at your nose and your mouth as well, okay? Good. Taxus and rhinitis. And could you open your mouth for me? Say ah. No redness there. I can see you've been to the dentist. I don't see any cavities or anything present there.
Okay.
All right. So that looks good. I am going to just test some movement of your head and things like that. So could you smile for me? Frown. Blow out your cheeks like this. Stick your tongue out. Side to side. Good. Could you look up? Chin to your chest. Look side to side like this. Good. And tilt. Good. Could you squeeze my hands for me as hard as you can? Good. And I'm going to put gloves on. And could you put your legs out and push down? Good. All right, so all of that looks good. I am gonna test your sensitivity
Okay.
on your face here. So I'm just close your eyes. Let me know what side of the face I'm touching, left or right.
Left. Right.
Good. All right. So that all looks good. So I'm gonna just move down now. Listen to your heart and lungs.
Okay.
So you're gonna listen up front first. Cleaning my stethoscope. And deep breath. Good. Is it okay if I lift your shirt?
Mm-hmm.
Okay. Sounds good up front. All sounds are vesicular. Don't hear any crackles or anything like that, so that's good. I'm gonna listen to your heart too. I'm just gonna get your apical pulse, which is around here,
Okay.
pulse point, just to see if everything sounds good. Clear S1, S2. Speaking to the camera. No murmurs present. Can I check your pulse?
Sure.
Normal rhythm.
Okay.
Okay? Feeling okay?
Mm-hmm.
All right, I'm just gonna have you do some more deep breaths. I'm just gonna listen to the back.
Okay.
Okay, go ahead. And I'm just gonna listen on this side here. And over here on the other side. Okay. Bilaterally, you sound good on both sides.
Okay.
Vesicular sounds, no crackles, so that's good.
Okay.
Heart sounds good too. So I want to move down to your abdomen here. This is where you're kind of having some issues. So just go ahead and sit back for me.
You want me to lift my shirt up a little?
Yeah, just lift your shirt for me a little bit, and I'm just going to take a look. Do you mind just pulling your pants just a little bit at where your bladder would be? I'm just going to take a look at that too. Okay, I don't see any distension there. Looks good.
Okay.
So I'm going to take a listen again. Let me just clean this off.
Okay.
Okay. Normal active bowel sounds. Nothing sounds off there.
Okay.
I am going to just feel now. Is that okay?
Yeah.
Just gonna wash my hands.
Mm-hmm.
I'm just going to feel around for any hard spots. Just let me know if you feel anything that feels tender or you feel pain.
Ow.
Hurting up here in this
Yeah.
right spot? Okay. Well, let's talk about that. That's what you kind of came in for. So when would you say this started?
Probably a couple months ago.
Okay. So it's up there in that right spot, right? How long would you say it lasts when it happens?
Usually like a couple of hours after I eat.
After you eat?
Yeah.
Okay. Could you describe the pain for me?
It's sharp pain, but sometimes it can be a little dull.
Okay. Anything seem to alleviate it?
Alleviate it, I would say, it just kind of goes away on its
Kind of just goes
own.
away.
But I do take ibuprofen
Okay.
at times.
Anything make it worse?
definitely gets worse after I eat.
Worse after eating.
Yeah.
Have you tried any treatments aside from ibuprofen or anything?
Just ibuprofen.
Just ibuprofen. And you said earlier, what was your pain level for today with that?
Like a 2.
Like a 2.
But then when you were touching it, probably like a 7.
Like a 7. Okay. So 7 pain when it's actually really hurting or being touched. And when you have when you're eating, it feels that way too, right? Like a 7 probably.
Yeah.
Okay. Is there any family history of, gastric pain or anything like that you know of?
I believe my grandfather had Crohn's.
Your grandfather had Crohn's.
Yeah.
Okay. That could mean something. Crohn's typically has that right upper pain. Okay. So that could be what we're seeing. The doctor will have to order either a CT or some sort of endoscopy to figure out what that is.
Yeah.
But that sounds pretty characteristic. What about your diet? What does your diet look like?
I eat a lot of fast food at times.
Fast food.
If I'm trying to eat healthier, like vegetables.
Vegetables, like raw vegetables, raw fruits.
Yeah.
At all?
Yeah. I mean, I like corn a lot.
Corn, okay.
And broccoli.
Yeah, that would do it. Have you been eating that a lot lately, or occasionally?
Here and there. Yeah.
Okay, so that could upset your stomach too, or upset that portion that's inflamed.
Okay.
So the way Crohn's works is there's a portion of your small intestine that's inflamed.
Okay.
And when food passes through there, especially food that's hard to digest, those hard pieces can really irritate that section. So you have to be mindful of that. Maybe foods that are softer, less fiber, so like rice, that helps. How about stay over there, buddy. Go sit on the couch.
Go.
How about under any stress?
Yeah, I've been going through a lot, with everything with COVID.
With COVID and stuff. Yeah. So stress can kind of make that inflamed because of the way the body releases like a corticosteroid type release when that happens, so that can inflame it. Okay. How about, you said you took ibuprofen for a drug when it's not feeling well? That can inflame it too. So Tylenol would be a better option because that wouldn't inflame. Okay. All right. How about bowel movements?
Every day.
Every day. Yeah. Okay. Loose, solid, soft.
More on the looser side.
Looser side. Yeah. Okay. So that could be a factor as well due to the inflammation. Okay. How about weight loss?
A little bit.
Same thing. So because it's the small intestine absorbs nutrients. If you're not getting good absorption, you could be losing weight. So you want to keep an eye on that. And we'll have to figure out a drug that can help relieve some of the inflammation.
My appetite has been okay though.
Okay, well that's good. Okay. Moving on, so I'm good with that. We'll have the doctor look into that further. Okay. How about urination?
Nothing.
Have you been peeing okay? Yeah. Mm-hmm. It's yellow, clear? Okay, yeah. Good. So let me just take a look at your skin overall. Okay. Go and hold your arms out for me. Just gonna feel temperature. Okay, turn over. Good. I'm gonna check your pulse.
Okay.
+2 both sides. I'm gonna check your cap refill. Okay. On both sides. Definitely below 3 seconds. Okay. So that's good. Do the same with your feet. Okay. Just gonna put gloves on for your legs. Just feeling temperature. Good. Gonna check your pulse as well. Okay. +2 both sides. I'm just gonna close your eyes for me and let me know which foot I'm touching.
Left.
Good.
Right.
Good. So good sensation in both feet. Just some general home questions. Do you have good support at home? Mm-hmm. Husband, kids? Mm-hmm. Okay. Said you're under a little stress, which could be contributing to the inflammation. Sexually active, having any issues paying bills at home, issues not affording medicines or food? No. Okay. Well, that's all I have for you. If you have any questions, let me know. My name's Sam. We're going to put your bed down. Here's your call bell. And if you have any questions, let me know.
Okay,
All right.
thank you.
You're welcome.